Intermittent fasting interventions for the treatment of overweight and obesity in adults aged 18 years and over. A systematic review protocol. Abstract review question. Objective. Are intermittent fasting interventions an effective treatment for overweight and obesity in adults, when compared to usual care treatment, continuous daily energy restriction, reduced-calorie diet, or no treatment, ad libitum diet? Background. Overweight and obesity, classified as body mass index, BMI, of greater than or equal to 25 and 30 respectively, is a global public health concern, with more than 1.9 billion adults worldwide being overweight in 2014, over 600 million of whom are obese, and resulting in more deaths than underweight. A raised BMI in adulthood is associated with an increased risk of developing a number of chronic diseases which include diabetes, cardiovascular disease, musculoskeletal disorders and some cancers. In addition to this substantial impact on individual health and well-being, there are also significant wider costs. For example, in England the annual direct cost to the National Health Service for treating overweight, obesity and associated morbidity is estimated at over £5 billion, with costs to the wider economy estimated at £27 billion. Therefore effective weight management is essential, as overweight and obesity results from an accumulation of excess body fat arising from an energy imbalance, consuming more energy, kcal, than is expended. The majority of weight management approaches center around behaviors to address this imbalance, i.e. reducing energy intake through caloric restriction and increasing energy expenditure through physical activity. However, the etiology of overweight and obesity is highly complex, involving an interplay of biological, psychological, societal and environmental drivers. Consequently, effective weight management is challenging, and whilst there exists a plethora of available weight loss programs, not all are comprehensively evaluated and compared, and many weight loss attempts result in weight regain and poor long-term results. It is therefore vitally important to review the effectiveness of all new approaches to support an evidence-based approach to weight management. Intermittent fasting, if also known as alternate day fasting, ADF, periodic fasting or intermittent energy restriction, IER, is a relatively new dietary approach to weight management that involves interspersing normal daily caloric intake with a short period of severe calorie restriction, fasting. In terms of the possible underlying biological benefits of intermittent fasting, there is some evidence, predominantly from animal studies, to demonstrate beneficial effects on weight loss and cardiometabolic risk factors. Whilst the underpinning mechanistic evidence is limited, there is some evidence to suggest that the benefits may be explained mechanistically through fat utilization and nutritional stress. However, current National Institute for Health and Care Excellence, NICE, guidance on the treatment of adult obesity does not recommend the routine use of very low-calorie diets, VLCD, defined as a hypocaloric diet of 800 or less kcal per day, for the treatment of adult obesity. The National Institute for Health and Care Excellence states that this approach should only be recommended if there is a clinical rationale for rapid weight loss and must be nutritionally complete, part of a multi-component weight management strategy, including ongoing support, and should be undertaken for a maximum of 12 weeks, followed continuously or intermittently. Furthermore, the British Dietetic Association raises concerns that rapid weight loss associated with fasting may largely be due to loss of water and glycogen rather than fat, and may result in fatigue, dizziness and low energy levels. Essentially, if involves the intermittent use of a VLCD, and there remain questions about the side effects of this approach, whether there is an optimal fasting pattern or calorie limit, and how sustainable it is for long-term weight management. Intermittent fasting has recently gained much popularity following significant media attention. In the UK, this dietary approach reached mainstream after a BBC Horizon documentary aired in August 2012, featured an IF approach called the 5-to-2 diet, which involves 5 days of regular eating patterns interchanged with 2 days of fasting, max 500 kilocalories for women and 600 kilocalories for men. However, other IF patterns are used, such as alternate day fasting. Despite the recent popularity of intermittent fasting and associated weight loss claims, the supporting evidence base in humans remains small and there is only one published systematic review examining the health benefits of this approach. However, the aim of this review was to examine the impact of this intervention on wider health benefits, not specifically as a treatment approach for overweight and obesity, and did not provide a comprehensive methodology or meta-analysis of RCT data. This proposed review will hence address these gaps in the evidence base. Fasting for weight loss, an effective strategy or latest dieting trend? With the increasing obesity epidemic comes the search for effective dietary approaches for calorie restriction and weight loss. Here I examine whether fasting is the latest, fad diet, as portrayed in popular media, and discuss whether it is a safe and effective approach or whether it is an idiosyncratic diet trend that promotes short-term weight loss, with no concern for long-term weight maintenance. Fasting has long been used under historical and experimental conditions and has recently been popularized by intermittent fasting, or modified fasting, regimes, in which a very low calorie allowance is allowed, on alternate days, ADF, or 2 days a week, 5-2 diet, where normal eating is resumed on non-diet days. It is a simple concept, which makes it easy to follow with no difficult calorie counting every other day. This approach does seem to promote weight loss, but is linked to hunger, which can be a limiting factor for maintaining food restriction. The potential health benefits of fasting can be related to both the acute food restriction and chronic influence of weight loss. The long-term effect of chronic food restriction in humans is not yet clear, but may be a potentially interesting future dietary strategy for longevity, particularly given the overweight epidemic. One approach does not fit all in the quest to achieve body weight control, but this could be a dietary strategy for consideration. With the obesity epidemic comes the search for dietary strategies to I. Prevent weight gain, E. Promote weight loss, and E. Prevent weight regain. With over half of the population of the United Kingdom and other developed countries being collectively overweight or obese, there is considerable pressure to achieve these goals, from both a public health and a clinical perspective. Certainly not one dietary approach will solve these complex problems. Although there is some long-term success with gastric surgical options for morbid obesity, there is still a requirement for dietary approaches for weight management for the overweight and obese population, particularly as invasive interventions carry post-operative risk of death due to complications. Effective dietary interventions are required that promote long-term adherence and sustained beneficial effects on metabolic and disease markers. In general, such interventions need to be palatable and satiating, meet minimal nutritional requirements, promote loss of fat and preserve lean body mass, ensure long-term safety, be simple to administer and monitor, and have widespread public health utility. Intermittent fasting or alternate day fasting may be an option for achieving weight loss and maintenance. Please subscribe, like, and share for more video like this.